different types of med administration. There can be multiple different kinds, and as you can see here, we have examples of some of those. So pills are typically going to be taken orally. You want to make sure the patient or the resident is positioned upright. You want to give somebody a drink maybe before and after you give them the medication, especially maybe they've just woken up, maybe they just took a bite of food and there might still be some food particles. Again, you want to, treat them with dignity, treat them with respect, get them prepared for the medication as well. So, give them a drink. You want to make sure that the medication is the same. You use that 3 checks. You check the order to the MAR, the order to the MAR, the order to the MAR, 3 different times, making sure you're doing that check before you're using pills. A lot of times when you're using pills, you're also using a med cup. You're gonna pop that medication into the cup before you give it. If you're crushing medications, especially pills, this is just kind of a generic pill crusher. This is one, if you were using this type, this would be individualized for the resident. This wouldn't be a community one. Each resident would need to have their own and their own name on it, and you would use it individualized. A lot of different facilities or places have like the ones where you put them all in a bag and then they have a crusher, so they are individualized, but you want to make sure that you're able to wash it in between so there's never any residual of the medication left for the next time around, because there could potentially be an interaction there if those are mixed. You always want to make sure that, again, when you're doing pills, that you're, again, reading the label, making sure you have the right dosage for the right pill. Anytime that you have liquid, you always want to make sure, again, that you have the right tools to dispense a liquid, because sometimes if you're giving it to somebody that isn't able to drink on their own, or something like that, or maybe it's a very small amount, you could have little syringes like this, and you have caps that sometimes that are like this in the bottle. So if you see these come with bottles, and these, that's what it's for, and that's so you can turn it upside down and you can get the accurate dosage. Because the proper use of these is to use the caps, or these types of caps. You never want to take your syringe and stick it down in the bottle and try to be pulling up out of the mass amount of liquid. That's just not very sanitary. And then also for liquids, it's really good to remember to try to keep the bottle as clean as possible. So when you're done, make sure you wipe the drip or something like that, because a lot of times you see these bottles and they get all crusty and it's hard to get the lid back on, and it's just not the most pleasant thing, and it doesn't look very nice either. And then one little tip and trick that I like to share with people is that on these bottles, there's a flat side and there's a rounded side, and most people don't know this, but if you always put the rounded side in the palm of your hand when you're pouring the medication like this, then typically you're gonna have the drip going down the flat side. And the reason that you put it on the rounded side is because the label at the pharmacy always goes on the rounded side, so that whenever you put your hand over it, you're protecting the label from when you're pouring the liquid, and if it drips, it doesn't drip on the label. Pretty simple, learned it myself, pretty amazing, right? The little things that people invent. I'm sure there's a patent out there somewhere that somebody made a lot of money on that, but just always remember that. So if you palm the rounded part and pour, you're going to save yourself from that. And then so that's that part with using the different things for liquid. And then also with liquid, if you're pouring into a graduated cup, again, always make sure that it has the measurement that you need. You never want to guess. If it only has 0.5 and 7.5 and you need 2.5, then this is not the cup for you. You want to make sure that you have a cup that says 2.5. You don't want to just eyeball it and do it right in the middle of 5, because that might not be correct. And you always want to make sure that's on a flat surface. And again, you're palming the round part of the bottle and you're pouring at eye level, and you're looking and making sure you're not going above that line. And again, that you're cleaning that bottle before you're putting it away. Some liquids, if they are a clear suspension, then they probably don't need shaken. If there's something that is a solution, or it's something that has been mixed, sometimes you'll see like the antibiotics that are liquid and different things, you need to shake those. Again, the directions should be on the bottle what you need to do, but you need to make sure that you're always reading those labels, and that whenever you are working with the liquid and you take the cap, you want to put the cap side up. So again, that's not touching any surface, bacteria, all of those things, and it's not getting dirty. Um, Another type of medication that can fit under the pills too, but it's the way it is absorbed is a sublingual medication. So that is something that's going to go under the tongue. Lingual means tongue, sub means under. So it's going to go under the tongue, and anytime that somebody is using a sublingual medication, you want to make sure that they're hanging their head forward, and that is so that they're not swallowing it and it's not going down their throat. Because if it is going down their throat, then it's not being absorbed at the right rate that it's intended to. So you just want to make sure that you know that. You always want to make sure if you're using anything sublingual, you can see vitamin B sometimes. It's not a very common way of administering medications, but again, that you're making sure that they're not chewing it and that they're not drinking for a few minutes after. Excuse me. With nitroglycerin, that's where, those ones are pretty specific. A lot of times you won't see those here in residential assisted living situations like this, but if somebody does have nitro or you ever come across that, typically it's a tiered order of administering that. So it might be give one and you wait 5 minutes, and if they're still having symptoms, you give another one, or some sort of scenario like that. So again, you always just want to make sure that you know that. If you have a new resident that moves in that has medications maybe that you don't know, or that's new, something like a sublingual, look it up. Use those drug books, use those resources, make sure that you know what it is, so that again, if you come to that emergency situation, you're going to be able to stay calm because you're confident in yourself about what you need to do to use that. So that's what's really important to remember with sublingual, because a lot of times those are emergency situations. Eardrops, so that's again something you want to have somebody sitting upright, or if you can, have them laying in bed on the opposite side that they have to go in. If they have to go on both sides of their ears, I actually recommend having somebody to sit up, because if you have them laying down and you go from side to side and then have them lay on their back, it's just going to run right back out. Where if they're sitting upright, it's actually going to work the way it's supposed to, because your eustachian tubes in your ears that connect to the back of your throat, that everything runs down through, that we want the drops going down into, gravity works, right? So you want them to pull down into your ears. So couple tips and tricks for eardrops is, if you're administering to a child, you're going to pull your ear back and up. If you're administering to an adult, it's going to be back and down. And again, that's just to help with the positioning of the tube in your ear to make sure that those drops are getting in as accurately as possible. Obviously, again, you can have them tilt their head a little bit to one side or the other while you're doing it, but the best once they're in is to have them upright. You can use a little bit of cotton from the outside, but if it's going to run out, it's going to run out. It's not really to keep it in, it's just more that if it's going to run out, then it catches it there. So you can always hand them a tissue or something like that. And you always definitely want to make sure when you're doing the eye drops, nose drops, ear drops, something like that, when you're dropping them in, that you're very careful that it's not like drop, 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 and you're only supposed to have one drop, right? You want to be very careful with that. So, sometimes if you have to do what they call like wasting a drop just to see how it squeezes out the first time, if you haven't given it, like know the bottle, know how hard you have to squeeze it, so you don't make sure you're putting extra in or something like that, because depending on what it is, it could irritate the area more if there's too much medication. Eye drops, I think we probably all see a lot of eye drops, especially with our elderly with dry eyes, different things like that. One thing I always teach and remember is, again, that dignity and respect with patients. Hand them a tissue before you come at them with their eye drops, right? Because their first reaction once you give them their eye drop is to go like this and wipe it. So have them have a tissue so they can wipe it away after you drop it. And another thing with those two is making sure that you're walking it through. All right, Miss Nancy, I'm going to give you your eye drops. Ready? I'm going to come to your right eye and I'm going to touch your eye, right? And then I'm going to take the drops and I'm going to put them in. So I'm going to be really close to your eye. Ready, Nancy? I'm coming close to your eye. Then you're going to come in, and what you want to do is you want to pull down that lower pocket and create a little cup, right? And that's where you put your medication. You don't want to put the eye drops directly onto the eyeball, again, because they could be an irritant, something like that. And if you're putting it directly onto the eye, it could just sting and burn a little bit more. So you want to hold that little cup out at the bottom. You want to make sure, again, that you have gloves on at that point, because you are touching potentially, you know, bodily fluids, and that medication could potentially get on your skin. So that is one thing to make sure with eye drops. Specifically in these situations, a lot of times you won't see it, but you want to make sure if you're doing eye drops, you know whether they're safe enough to do with contacts or not. Some medications are going to tell you not to administer if you're wearing contacts, and again, those directions would be on the label. So remember that one. So eye drops and eye ointments are two different things. Drops are going to be a liquid drop ointment. They're usually more of in like those little aluminum things where just a little ribbon of medication comes out. And so that's where, again, you drop that little ribbon into the eye, and you want to try as much as possible not to ever touch the applicators onto the eye or onto the body when you're using anything like that. Let's see, so on to topical lotions and creams. So this is definitely something, again, you want to use gloves for. We always use gloves when anything can come in contact with our skin, so you're protecting yourself. And when you're doing lotions and creams, you always want to make sure you're on the right body lotion. So medications could be in a cream form for different regions. It could be for a specific region or body of the area, or it could be a medication that just needs to be absorbed in the skin and it's systemic and it needs to go everywhere. So for instance, if we have somebody, and we see this on hospice, is where if they have a lot of agitation and they need maybe like Ativan or something like that, but you're not really good at getting it in because they don't like to take their medications anymore, the dementia, something like that is causing it really hard to get medications. You can actually get Ativan in a cream, and you like slap that puppy on and rub it in a little bit, and with like, it really relaxes them, and it helps gets the medication into them without orally when you can't do that. But a lot of times your general lotion, something like that, you know, make sure that, again, you're just protecting yourself. One thing to touch on here too is that if anything's over the counter, so even something like sunscreen, I believe in an assisted living like this, that's considered a medication, so you have to have an order for that. So it would have to be like PRN of going outside, reapply every so many hours. It has to have the specific directions on it. And again, you want to make sure that those are labeled with the resident's name and potentially their room number on it. And you want to make sure that you put the date that it's opened. Inhalers, those again can be used in many different situations. They can be daily, they can be multiple times a day, they can be as needed. So again, you want to make sure that you're shaking them up. A lot of times they have specific directions. Usually it's just a good like maybe 15 seconds. Again, with the inhaler, you want to make sure you have somebody sitting upright, and again, you want to be walking them through that, giving them cues. Okay, Miss Nancy, we're going to take our inhaler now. We're going to put it in your mouth, and on the count of 3, I'm going to push the button and you're going to breathe in. Ready? Let's practice. 1, 2, 3. Do it with them, right? Talk her through it. And then the next time you're going to be like, okay, here we go. We're going to do the real thing this time. You're going to put it in her mouth. All right, Miss Nancy, on the count of 3, we're going to breathe in. 1, 2, 3. And you're going to breathe in with her, right? You want to make sure that you're walking your patients through it, cueing them through it. If you have somebody that can still do it themselves, promote them to push the button and inhale themselves. Because again, the timing of that, they're going to inhale and push it at the same time, because it's a normal response, especially if it's somebody that's used an inhaler for a very long time. They'll know how to use it, when to breathe in. So always promote that independence for sure. And again, on some, you want to make sure you know the number of puffs, because it could be 1, it could be 2. Some inhalers also have maybe it's a capsule that you're putting into the device, and then whenever you hit the button, it actually crushes it and it releases the powder. Again, on those ones, you want to make sure you're reading the directions, because a lot of them, they want you to rinse the mouth out after, and that's because, again, the medication can be very acidic and it can break down the enamel of the teeth or cause, you know, maybe some hanker sores or different things in the mouth. So you want to make sure that, again, you're reading the directions, and a lot of times they taste funny, so even if it doesn't say rinse the mouth out, again, you usually want to, you know, give somebody a drink of water after to make sure that you're rinsing that out. transdermal patches. So again, those can be used in a lot of different ways. They can maybe be an Aspercreme pain patch that you're putting on a specific location for a regional pain in the body, or maybe it's something like a fentanyl patch or a pain patch that you're putting, again, just for the medication to be absorbed into the bloodstream. So depending on where that is, making sure you have the right location, and that always, no matter what, when you're putting a new one on, the old one is coming off, especially when it's something like fentanyl or something like that that's a systemic. Aspercreme pain patches probably won't hurt somebody too much if they have more than one, but if it's a pretty strong medication, you want to make sure that you're removing the old patch. If it is a patch that's not for the regional location, like a pain, like the Aspercreme patches or something like that, that you do want to rotate sites, and you want to make sure that you're washing with soap and water before and after an application. So if you're taking an old patch off, you want to wash with soap and water after you're done, to make sure if there is any medication left on the skin, that you're washing that off. And then anywhere that you're putting the new patch, you want to make sure that you're washing that area to prepare the skin, so that if there's any lotion or anything like that, that the patch will actually stick. Let's see. And then also remembering with the patches, especially in facility situations like this, they want you to time and date them of when you're putting them on. And then if they are something like a fentanyl patch or narcotic, there's going to be an accountability to that too, that typically on your shift, you're going to sign that you witnessed the placement of that, because they're usually on for a couple days at a time. Usually like every 4th day you change those. So within those 4 days, you're going to be signing somewhere acknowledging, yes, it was on her right shoulder, and then the day changes. And so you want to make sure that there's that accountability in between each one as well. And I think that wraps up all the different